Salomon, and today I'll be validating on setting up an IV and an IV piggyback. I've obtained the physician's orders, I've washed my hands, I've identified and introduced myself to the patient, I've gathered my materials, I have explained the procedure to the patient, and I've provided privacy. And I have the right patient, the right documentation, the right drug, the right dose, the right route, and the right time. So I'm going to begin, and I'm going to check the IV site for any redness, swelling, or patency, and this patient is good. And I'm going to flush the IV to make sure it's working properly. And I have the correct medication, I've checked the expiration date, I've checked the physician's orders and their medication records. So I'm going to take the cap of the primary bag, and I'm going to take the cap off, and I'm going to spike the bag. And I'm going to clamp the tubing.
Okay, now the bag is set up, I'm going to label my bag.
And I'm going to write my label with the medication, the patient's name, the date, the time, and my name. And now I'm going to unclamp. So I'm going to prime. So I'm going to fill the chamber up halfway. And I'm going to make sure that there's no bubbles.
Well, it was just opened up, so it's actually pretty sterile.
And I'm going to take the cap off. And I would clean this and connect it to the IV site and clean the IV site. But for now, we're just going to do it in the basin. So all my bubbles are gone. So I'm going to go ahead, close my tubing. And now I'm going to do the drip rate. For this medication, we're doing 40 drops in a minute. So that is going to be 10 drops in 15 seconds. Okay. Now I'm going to slowly open up the tubing. And I'll say when I'm ready, when I make sure I have the correct rate, and just test it. Okay, I'm going to do it a little bit slower. Okay, I have the correct rate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and now I'm going to close my tubing. And this patient is going to be having a secondary IV. They're going to be having their piggyback for their second medication. So I made sure I have the correct medication and that it's not expired and it matches the records. So I'm going to take this top off, and I have my piggyback tubing opened. I'm going to take the cap off, and I'm going to spike the bag. And I'm going to close this.
It was the one that was
And I'm going to clean 15 times. And I'm also going to clean the highest port on the primary tubing 15 times as well.
What are they called for Spanish? Quinceañeras or something like
Yeah, 16.
Yeah. There we
Now
go.
I'm going to attach the
Why are my bags in the floor?
I'm going to hang my primary bag lower. And now I'll be doing the drip rate for the second tubing for the piggyback, and my well is filled, and I'm priming. To make sure there's no air bubbles. And I'm filled halfway. And I'll be doing the same rate, 10 drops in 15 seconds, 40 drops in a minute. Seven, 8, 9, 10. All right, 10 drops in 15 seconds. Perfect. Okay, and I'm all ready to go, and I'm going to label this one as well with the patient's name, my name, the time, date. And that's it. And then I'm going to leave the patient. I'm going to wash my hands, and then when I come back and the piggyback is done, I'm going to make sure I have the correct drip rate for this bag, which was also 40 drops in a minute. Okay, thank you.